I'm very thankful that I spent that period of my life reading medical records because, I spent 6 days a week, 10 hours a day reading and extracting information from medical records. So I've probably read thousands of times more records than most physicians. Because they're busy practicing medicine. So I was able to take an enormously deep dive into the medical records. And what was astounding to me was the amount of misdiagnosis. Diagnoses will go into a medical record and nobody ever checks it. They go, okay, this patient was diagnosed with rheumatoid arthritis, but I would look in the record and say, where's the rheumatoid RA factors? Where's the SED rates? Where's the blood work confirming this? There's no diagnostics. And then we go back into the patient history and realize the patient went to see their primary care physician and described their condition. And the doc said, you've got rheumatoid arthritis. I'm just going to hit you with some high-dose corticosteroids. And you would just start them on corticosteroids based on the patient history. And I would see this thousands of times. And then I would look in the record and I would notice they've been clinically single-digit deficient in vitamin D3 for years. And it's showing up as multifaceted joint pain. And they're telling the doctor this, and the doctor without knowing the vitamin D3 level, just says, well, you've got rheumatoid arthritis. Well, we knew if you started corticosteroids that you had 6 years and 1 day until you were having a joint replacement. So now I had to advance that patient's age artificially 6 years and 1 day. I had to schedule the joint replacement, and then I would begin to reduce what's called their ambulatory profile, how well they ambulated, how mobile they were, because we know that sitting is the new smoking. Yeah. Right. Sedentary lifestyle is the leading cause of all-cause mortality right now. And so I would begin to reduce their ambulatory profile. And then I would bring in all of the diseases that exacerbate with reduced mobility. So I would bring diseases forward from their future that they likely never would have had into their present. And then I would predict how quickly they would succumb to that disease. And if you think about the progression of this, they had a simple nutrient deficiency, were misdiagnosed with a condition that they did not have, put on a medication that was not required, which caused a surgery that wasn't necessary, which reduced their mobility and brought diseases forward they never would have had, and they died from a condition they never should have had.
Changed the whole trajectory of that one thing changed the whole trajectory of their life going forward.
And when I say I saw it thousands of times, that is not a sensational exaggeration. I saw it thousands of times because I would have the full medical file and I would say, well, I see that this person got diagnosed with Parkinson's, but then I see another physician has pulled viral pathogens, and they have these viral pathologies like West Nile and Zika, and the symptomology between West Nile and Parkinson's is superimposable. And the Parkinson's neurologist is throwing out the elevated white blood cell count because I can see here that they're going to disregard it because it's, they can't find a diagnostic rationale for it. So they're going to ignore it. And I would just in my mind go, oh my gosh, he actually has a chronic West Nile infection, not Parkinson's disease, and he's on Parkinson's medication, which is not working, while this viral pathogen progresses and seemingly Parkinson's symptoms are getting worse, but it's actually the viral pathology that's eating away at him. And again, I could give you hundreds and hundreds of these, and it was really sad to actually have access to all of this record and want to pick up the phone and say, hey, stop the Parkinson's medication, start taking an antiviral. Of course, I wasn't licensed to do that, and I didn't do it. But I wanted to contact the patient or the treating physician and say, listen, you have a virology lab that's popped in positive for this chronic viral pathogen. Why don't you start an antiviral protocol and see where that leads?
And something as simple as low vitamin D that can be easily fixed. Why is that? Doctors are not trained to look for nutritional deficiencies.
And we're also not trained to know what the deficiency, a nutrient deficiency, expresses as disease. So, for example, in Dana White's case, not to keep coming back to Dana White, but I was like, well, why are you on heart medication? I mean, I looked in your medical record. You've always had a normal EKG, a normal EEG, a normal stress test, and normal heart and lung sounds. I mean, all of your cardiac workup has been normal. But what you do have is a genetic inability to lower something called homocysteine.
Ah, yeah.
Too, by the way, you have the same condition, which is why we recommended trimethylglycine.
Okay.
And so homocysteine is a natural amino acid in the human body, but when it gets to very high levels, because you have a gene mutation that doesn't allow you to metabolize it, As it rises, it becomes one of the most inflammatory compounds in the human body. Well, as homocysteine is cruising by the interior lining of the arteries, very often what it does is it irritates the arteries like glass nails on a chalkboard. And so what happens is when you irritate an artery, it clamps down. When you make the pipes smaller in a fixed system, pressure goes up.
Yeah.
There's nothing wrong with the heart, although, modern medicine very often is perfectly comfortable holding the heart responsible for a crime it's not committing. So we start pounding on the heart with diuretics or beta blockers or calcium channel blockers or other cardiovascular medication, ACE inhibitors, even though we don't have a diagnosis of anything wrong with the cardiovascular system. And we forgot to look at the nutrient deficiency, trimethylglycine, that doesn't allow them to break down homocysteine, which is causing this to rise, which is making 63,000 miles of blood vessel more narrow and driving pressure up. This is why the majority of hypertension is diagnosed as idiopathic hypertension or hypertension of an unknown origin, right? It's not that the origin is unknown, it's just that it's not the heart.